Hello guys, welcome back to the channel. It's Unit 8 Part F. Cord prolapse. Cord is nothing but umbilical cord. See, generally in the delivery process, first baby comes out and then the placenta umbilical cord will come out. While in some condition due to excessive contractions or any other condition, the umbilical cord presentation will come first before the baby gets delivered. While this cord representation has two types. One is occulta cord prolapse. Second is overt cord prolapse. Occulta is nothing but with the baby, beside the baby, the umbilical cord will be visible. Generally, it will not be visible. In normal delivery, only baby's head will be visible or baby's leg, based on the presentation. If it is normal presentation, baby's head will be visible. If it is in the breech presentation, baby's leg will be visible. But umbilical cord will not be visible. While in this condition, with the visible of baby's head or leg, with that the umbilical cord also will be visible. You can see here in the pic. While second type is overt cord prolapse. In this, before itself the cord will get delivered, in the sense outside the vagina the cord will be present. That is overt cord prolapse. These are the two types of cord prolapse. What are the risk factors of cord prolapse? If there is one or more babies, like twin babies, at this condition cord prolapse occurs. Apart from this, in 7.5 months, the presentation of baby umbilical cord placenta is different from the full term baby. So at this time also cord prolapse can occur. If the baby's weight is less than 2.5 kg, then automatically the size of the baby is also very small. So in this condition it may occur. If the baby has any abnormalities at this condition, or else if the presentation of the baby is in the different than the normal one, then at this condition also cord prolapse can occur. If the amniotic fluid present in the stomach is less, then in this condition also cord prolapse can occur. Apart from this, if there is any abnormality in the placenta, if there is any problem in the location of the placenta, the cord prolapse can occur. Diagnosis: ultrasound is performed. Ultrasound is performed to make sure whether the baby is alive or dead. Based on this status, we will come to know further what to do. Like, if the baby is alive and vaginal delivery is possible, then we will perform the delivery with the help of forceps, like low head forceps or high head forceps. If the vaginal delivery is not possible, then we will perform further thing, like not applying more pressure on the cord by reducing the infusion of oxytocin. If oxytocin infusion is stopped, then the contraction of the uterus will be stopped, then the further movement of the cord will be stopped. And apart from this, we will try to insert the cord inside the vagina. That is performed this way. First, we will secure the bladder by filling it with normal saline, and then we will place a pillow under the hip, and then by introducing our fingers into the vagina, we will try to replace the cord into the vagina. And after that, C-section will be performed in a safer manner. This is the management of cord prolapse. Rupture of uterus. Because of excess use of oxytocin and other conditions, the uterine contraction will be excessive. This excessive uterine contraction will cause injury and damage to the uterus, and it will affect the normal delivery, and that is rupture of uterus. This rupture of uterus has been a common symptom for the death of fetus as well as mother. The normal good antenatal care can actually prevent this rupture of uterus. Now, what are the causes of rupture of uterus? If there is any previous scars because of C-section delivery, the previous delivery was C-section, because of that there is a scar, or previously there is an operation, because of that there is a scar and it is not fully healed. Because of it is not fully healed, the uterus will be very weak, and this can lead to rupture of uterus. And next, obstruct labor. If there is anything that is affecting the normal delivery, like there is an object that is blocking the way, like there is a tumor or baby's malposition, malpresentation, can lead to rupture of uterus. And excessive use of drug. If the delivery is not going in a proper way, then automatically oxytocin will be introduced. If it is introduced in the excessive amount, then automatically the uterus movement will be more. CPD. If there is multiple paternity, that is twin baby or more than that, weak scars, malposition, malpresentation. These are the causes of rupture of uterus. Diagnosis, clinical measurements will be taken first, like personal data, height, weight, vital signs, sign and symptoms, everything will be taken. In the section of history, we will get to know any previous surgery is undergone or not. If the woman has undergone any previous surgery, then she has a scar. We need to take care of it. And ultrasound, by that we'll get to know whether the baby is alive or not, in which position the baby is present. To confirm this is rupture of uterus, we will perform laparotomy. Treatment is generally C-section. It can be either prenatal birth or full-term birth. In prenatal birth, in the 7.5 months, if mother gets pain and it is rupture of uterus, then we will perform C-section. The baby is born. It can be alive or dead. Both the conditions are quite possible. We will advise the mother to not get conceived for next 1 year. She should not get pregnant for next 1 year. It is because the scar which is present now and the uterus condition should get developed, should get healed. So we will advise the mother to not get pregnant for next 1 year. If it is a full-term pregnancy, then we will perform C-section and we will take care of the mother. In some cases, mother might get shock. For the shock, we should provide immediate treatment. Then blood transfusion should be done. Preoperative care for C-section should be given. If we are suspecting that the patient might get the rupture of uterus, we need to inform all the members about this condition and we need to provide IV line. Mainly 2 IV lines will be given. The blood for the patient will be arranged and immediately C-section should be performed. So the patient will be taken to the operation theatre. We provide medications for the pain, tears and sutures will be done. For that, the gentle care will be provided. Good healthy nutrition diet will be provided. These are the managements for the rupture of the uterus. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.